Viruses change their form or structure in order to keep on surviving, and COVID-19 is not any different. In this episode of Health Watch, we take a look at how dangerous this pandemic is and who is at risk of being infected. My name is Saida Hassan. Like a storm, the coronavirus pandemic hit the world starting 2020, and everything changed. Nothing remained normal. Countries from the superpowers to low and middle income countries faced the wrath of the disease. In Kenya, class was no longer an issue as the rich and poor struggled to secure oxygen cylinders and bed in full hospitals just to survive. Kenyans from all sectors have been affected. Celebrated health workers lost their lives to the pandemic. Patriotic Kenyans whose families were left behind dealing with stigma, and leaders in the communities.
Wonderful. It feels so nice to be back home. You know?
I'll just keep my distance from
it. I was like, you know, a prison back. And it's nice to be in fresh air, see the greens, you know, around here, you know, even though I'm still in isolation.
Some have come out publicly to speak of their battles with COVID-19, even to an extent of lacking the basic commodity, oxygen.
Everything that CS keeps talking about was actually being replayed, you know. In my life, you know, he talked about the issue of no beds. I experienced that. Now he's talking about maybe people using at home. Now this is people using oxygen at home. It is now happening to me. There were no cylinders. There was actually an appeal that anybody having the cylinder at home should actually take it back to a medical facility so that it is going to be of help to other people.
According to Centers for Disease Control and Prevention, older adults are more likely to get severely ill from COVID-19. 4 out of every 5 deaths recorded occur in adults above 60 years of age. The Ministry of Health has often encouraged Kenyans, especially those living in urban areas, to keep away from visiting their elderly parents to avoid transmitting the virus to them.
Statistics have shown that majority of our elderly people live up country and that they are likely to get exposed, as it happened in Italy, by this kind of movement. Therefore, we would like to urge in the strongest terms possible to urge those who live in Nairobi to stay in Nairobi, those living up country to avoid traveling to Nairobi as much as they can.
Kenyans have varying views on who can easily get infected with COVID-19.
Everybody is at risk. The only thing we just pray and do the regulations which are being told, the mask and the sanitizers and sort of things.
People are upset to know about the dangers of this disease. I think the rest they can just take care of themselves because they can just get from our CS about the dangers of this disease.
Everyone is at risk. It depends on how you protect yourself. Sanitize, wear your mask, social distance yourself. Mambo mingi wache.
Hakuna mtu hawezi pata, hata mimi naweza pata, but the thing is you have to cover, wash your hands na ujichunge yani.
Sijaona chokolata moja ameanguka kwa ugonjwa. Sisemi hauko, lakini wewe angalia mambo ya Mungu. Ni kama analinda maskini sana.
Coronavirus sifikiri kama mimi naweza nipata, but naelewa ya kwamba iko.
The COVID-19 Delta variant B16172, which was detected in the Lakeside region of Kenya, is now finding its way into the community. Proof that the virus is mutating. Scientists say that it is more transmissible and causes high hospitalization rates.
And what is of concern and of importance, and particularly to those who reside in those 13 counties, is that we have been able to pick out cases of the Delta virus. And it is important for us to ensure that we really adhere to these measures because we want to prevent community transmission. We want to prevent a situation where this virus is not jumping from one person to another in the community.
Some Kenyans are familiar with COVID-19 issues, while some are oblivious. And the Delta variant, for example, is something alien.
The new variant, I just know I think that it's much dangerous than the rest. The third era in. Yeah.
It's more dangerous ukikataa kujichunga. The thing is ujichunge, lakini sasa sisi tunapuuza, kama Kenya tunapuuza sana.
Sijasoma sana kuhusu mambo hayo ama sijashughulika sana kwa kujua mambo hizo variant, lakini hayo sijui sana.
Hii ya Kisumu ni mbaya sana, ni kama ile yenye iko India. Ni mbaya, so ni watu tu wasimamishwe kwenda Kisumu. Wakienda na wakiingia hapa Nairobi wataileta huku na tutakuwa mahali pabaya, na saa hii corona mahali imetufikisha, uchumi wa Kenya umekuwa chini sana.
Asked who is at risk of getting COVID-19.
If you have a history of medical conditions, depending on if you're a smoker and your age, if you're old, but for someone like me, I can't say I'm immune. Yeah, but I don't feel like it's much of an effect as much as I take precautions about it.
Yeah. Although many are saying that it really affects the elderly so much, but no, the children, you know, when you do something with an I don't care attitude, like that thing, it easily affects you without knowing, and you realize it when it's late. But with the current trend, now that they're being said that it affects the elderly, much precautions have been taken.
Mi naonanga ile group ya age inaweza pata COVID ni ile age inapenda like teenagers hapo ma 20 something to ma 30 mama ma 40 hapo, because they are like okay, they can do anything, they don't care.
Ngoja huko uraizi inaweza pata mtu tuseme mwenye ako na kanza, yani kikupata kama uko na ugonjwa ingine, hiyo ndo inakimbizana na yeye kwa haraka sana. But kama una ugonjwa ingine, ukikimbia hospitali masaa yenye inatakikana, hakika unapona corona.
Ukiangalia sana wakati mwingi unaona kwamba wale watu ambao ni wararahoe, Mungu anawalinda sana. Na ukiangalia kiulimwengu globally, unaona kwamba kama US, kama Brazil imewaweza. Lakini angalia nchi za Afrika ambao wanaonekana kama ni wapumbavu, hawana teknolojia ya kutosha. Na ilhali unaona Mungu anawalinda. Kwa hivyo mambo ya Mungu nayo yako mambo ya Mungu yanaonekana.
Dr. Anthony Odek, a sociologist, says that human behavior is pegged on a familiar pattern.
The minister will read statistics about Kisumu, but then the same politicians, you'll find them in rallies talking about political agenda. They're not talking about COVID. So we Kenyans are finding themselves in a situation where there is that conflict. What people say and what they do is quite different. Even governors, they talk about COVID, but you ask yourself, what have they done to contain COVID?
The positivity rate falls short of the required 5% to ascertain that a country has taken control of managing the pandemic. A rising wave is still being observed as daily new infections increase. Counties that were once recording low numbers now showing a different picture. The lakeside region still is a point of concern.
One key thing that is worrying us is that the attack rate, which is a measure of the new cases within these counties, has almost gone up 15-fold in these counties. And so really we need to pay attention to all the adherent measures that have been set, along with all the restrictions that we've been able to release in the past 1 week.
Various measures have been put in place to address the pandemic. Lessons have been drawn from how countries dealt with Ebola and HIV/AIDS. Dr. Odek says that he draws a good lesson from Botswana in managing COVID-19.
We can borrow a lot from the structures that were put in place in Botswana to address HIV/AIDS. And even Kenya has been trying to address HIV/AIDS in that you have structures at district level. Right now we would be talking about at county level, at sub-county level. We are supposed to have COVID committees at county level, sub-county levels, even up to village levels. And these structures are supposed to be facilitated to address, talk about information about COVID, and also to involve other players like the church, the Islamic community. They are key players in addressing COVID. At the moment, religious institutions are feeling like they are being bullied by the politicians. And yet, if you look at in Botswana, the church, the religious groups were very active in addressing HIV/AIDS.
Experts say that vaccination is the best bet in fighting this pandemic, despite the new variants of concern like the B117 alpha variant, B1351 beta variant, P1 gamma variant, B1427 and B1429 epsilon variants, in addition to the Delta, continue threatening lives globally. So far, Kenya is almost at 200,000 COVID-19 cases and over 3,400 deaths recorded.
What is the value of life in this nation when we read numbers of people who have died in Jaramogi Oginga Odinga Hospital? Those are human beings, those are lives, those are just not numbers. But why can't we match our word with the funds that we receive to address the issues of treatment, to buy things?
Indeed, values reported are not just numbers. They are fathers, mothers, sisters, brothers, daughters, sons, or even our children. COVID-19 is still a threat, and it is not yet time to loosen the grip in fighting the pandemic. It can affect anyone and everyone. Saada Hassan for Health Watch, KTN News.